Hello, I'm Dr. Eric Mazer. Today's Ask the Expert question is, what are some examples of population health management? On the set today we have Dr. Tait Michael. She's a psychiatrist, but you're also in charge of community health for the Western Connecticut Health Network. Tait, we talk population health. Just briefly, what is it, and give us some examples.
So population health is really the effort to take care of the whole population, not just the individuals who come to your office as a doctor. So a couple of programs we have, one is embedding psychiatric social workers into primary care practices so that they can deal with the problems right there in the office. They don't have to go make an appointment and wait 3 weeks. They can get it done right then.
And that must be much more comfortable for the patient too, because it's part of their regular doctor's office. It doesn't require a special visit. I think you've mentioned not everybody referred to a psychiatrist actually follows up, do they?
No, they only go about half the time.
So this assures that patients with psychiatric problems, and it doesn't mean that they're raving mad. I mean, depression is a very, very, very common, isn't it, in the primary care?
Depression is very common. It happens in up to a quarter of all women and many men as well. It's very common.
Men hide it better, but.
Right.
But and also it also drives a lot of healthcare costs too. Doesn't people with depression, don't they often end up with drug and alcohol problems and then complications of those addictions?
They do often coexist. And if we think about the things that drive the cost of healthcare, and what that means is they drive people to be less healthy, they're health behaviors. So their addictions and smoking and exercise and diet and that sort of thing.
So we have about 30 seconds left. How about community care teams? I know that's another initiative that you're involved in.
So our community care teams are really a group of dedicated agencies in Norwalk that come together and they take care of the people who are really the most vulnerable in our community.
And you actually identify those people by name and set up plans for these agencies working together?
Exactly, we do. We identify them by how often they come to the emergency room because it's an excellent marker for unstable health care and social needs.
So this is, again, an example of providers, the healthcare, reaching out to care for people rather than sitting back and waiting them to come to us.
That's exactly right, being much more proactive.
And it turns out it's better care and it saves money, which is really amazing.
That's right.
Thank you, Tait. That's so useful. And if you have questions at home, please send the questions and comments to me at healthtalk@wchn.org. I'd love to hear from you. Bye-bye.